HIV and AIDS. And we're trying to cut through the noise and get to the voices that are doing the hard work on the ground, that's making a real difference in people's lives, people that are affected and infected by the HIV and AIDS pandemic. And joining us now is Monwabisi Sidwell Mbasa, Chairperson of the Treatment Action Campaign here in Gauteng, and then has long been played a pivotal role when it comes to advocating for access, rights, and accountability in the fight against HIV and AIDS. Monwabisi, thank you so much for joining us this morning. Welcome to Salam Media. Really appreciate you giving us your time. How are you?
Thank you so much. I'm very well, thank you. And I would like to extend my greetings to your listeners as well. It's always a pleasure to engage with you around these issues.
No, the pleasure's all ours. I think we can quickly kickstart the conversation by, just talking about the status and gaps of where we currently find ourselves when it comes to the fight against HIV and AIDS. The key thing right now is you guys are working, on this program and this conference is happening at the backdrop of those funding cuts from PEPFAR, from USAID. We've seen in other countries across the continent and other, quote unquote, third world countries, the impact that, those funding cuts have had. Looking into South Africa specifically, have there been any changes? Have people with HIV and AIDS been directly affected by the funding cuts that have come from the United States of America after Donald Trump's announcement that there won't be any, U.S. money be given to such programs that are backed by PEPFAR and USAID?
Yes, no, thank you very much. And I'm happy that you raised that particular question. Yes, the gap has been there. People living with HIV have been grossly affected. You would remember that the PEPFAR funding used to cover a larger portion on HIV, TB, and STI response. So the services have been slashed, and now we're back to square one when it comes to facilities being overcrowded, the long waiting time expanding. However, we still have people who are accessing treatment, but the demographics that have been severely affected are people that we categorize as key and vulnerable population. Talk about people, men who have been sex with men, people who are using drugs, sex workers, and so on. So those are people who are grossly affected because at that time when we still had the funding, there were facilities that were given funding to sort of, roll out services that talk specifically to that population, but unfortunately that had to close. So those are some of the repercussions of this funding cut. Hence, we are pushing for yes. Oh, okay, maybe I'll come after.
Yes, no. I was just saying that's very, very concerning. But I just wanted to look at the conference this year. If you can maybe look back from the previous conference, the last national conference that was had, and looking into this year's one, were there any kind of like you guys saying, okay, these are some of the issues that we're going to be tackling, and we're going to reassess going into this year's conference about where we got it wrong and where we got it right? Just the reflection on the previous conference going into this one. What are some of the key areas were of concern, and how were they dealt with? Maybe let me put it that way.
All right. Okay. No, that's fine. So the last conference of this nature was held in June in Durban. One, we didn't, like at that time, there was no Trump executive orders to talk about, right? Number two, we did not have a campaign called 1.1 million of people that is disengaged from care that needs to be, found in the communities to be reinitiated on care. So those were issues that were not there. Now we're grappling with those issues. The last issue that was not a buzzword as it is in this conference today, the 2-year injectable HIV prevention method, right? So that was not in the picture in the previous year. Not to say there were no challenges. Of course, challenges have always been there, but now we are now having new challenges which are now exacerbating the crisis that we find ourselves in. which were compounded by the advent of Trump's, funding cuts. So now what is happening in this conference? There are three interrelated challenges that we are grappling with. One is an issue that pertains to lenacapavir, the HIV prevention method. So here, the advocacy that the civil society is advancing in the forefront is to say, we want the DTIC, the Department of Trade, Industry and Competition, to regulate the patent laws, right? Number two, we are pushing for SAPRA to admit, or rather to sign lenacapavir as a drug that needs to be distributed in the country, that needs to be approved. And then thirdly, we are pushing Gilead to reduce the price of lenacapavir so that it can be able to be affordable to vast majority of South Africans. So that's where now we are. We want lenacapavir. So there's been demonstrations, there's this advocacy that talks about that. Secondly, we're talking about the sustainability plan. In other words, we want to reimagine the HIV, TB, and STI response, post this dilemma we're in of Trump having withdrawn his resources. How do we sustain those programs? How do we ensure that we don't get off track, from the trajectory of wanting to attain our goal of ending HIV, TB, and STI by 2030 as public health emergency? So we are trying to tap into the available resources, the domestic, funding. How do we ensure that we plug resources into this particular, I would say, response leading up to the goals that we want to achieve? The point, human rights. Key and vulnerable populations still find themselves in the periphery. Their human rights are being trampled upon and being undermined, to say the least. So how do we ensure that everybody's human rights are being actually upheld and respected as well? And then guaranteeing that these demographics do not find themselves outside of our constitution, the section 27, subsection 1A of the code, that everybody has the right to have access to healthcare services and reproductive rights as well. So now those are three interrelated challenges that we're grappling with. So that's what this particular conference is registering from civil society, and to say how best can we work together, private sector, public sector, which is government and society, to ensure that we close all those gaps.
All right, I think we're going to leave it there for now. Monwabisi, thank you so much for unpacking it for us. We hope you have a successful conference because it's a very, very important one, especially looking at the current state of affairs, those executive orders that we're supposed to be dealing with, and just the numerous research that's coming out when it comes to dealing with HIV and AIDS. I think we're in really, really interesting, uncharted waters, and important real work still needs to be done. Really appreciate it.
Thank you so much. Have a good one.
There you have it. That was Treatment Action Campaign Gauteng Provincial Chairperson Monwabisi Sidwell Mbasa giving us insight on this year's 12th South African AIDS conference that's currently taking place in Johannesburg. It's happening at the Empress Palace here in the east of Johannesburg, and registrations are now open for those that want to be a part of it, for those that want to join and have a conversation about one of the biggest pandemics South Africa has ever had to deal with. And this time around, it's coming at a time where the support from the United States of America is not as there. There's so much research when it comes to HIV and AIDS, and there's so much education that's currently happening. So I think, there's going to be a whole lot of engagements that are going to be had, engagements with experts and thought leaders in the field of HIV, AIDS research and care, because some people might see it as a success, some might not, but I definitely see it as a success. The fact that South Africa has been, for the largest of parts, being able to deal with the scourge of HIV and AIDS across the world. We're having a conversation with one of my African brothers, and he was like, South Africa is the highest number of people living with HIV and AIDS on the continent, and amongst the highest in the world. And I said, we should be celebrating that, celebrating the fact that we're able to know and track. We have the mechanisms in place to understand that we have such a big population of people that are living with HIV and AIDS. If you go across the African continent, most people, the numbers are not even there. You know, the mechanisms of research are not there. South Africa boasts the highest antiretroviral rollout campaigns in the world. Nowhere else in the world do you have people that are documented that are receiving antiretrovirals at a scale that South Africa is. That's one of the reasons why we dealt with the coronavirus so well. You know, we have mechanisms in place, we have systems in place that deal with the pandemic. We know how to track people, we know how to contact people, we know how to roll out mass medication to people from every corner of South Africa. So yeah, HIV and AIDS really, really bad and claimed a lot of lives, especially in the earlier stages. Late 90s, early 2000s was really, really horrible. But I think we got the hang of it. You know, we there's so much studies across South Africa's major universities about dealing with HIV and AIDS that we can call it one of our success stories to a certain extent. I know a lot of people might not agree, but hey, that's just my opinion. Yeah, but yeah, the 12th SA AIDS conference currently taking place here in Johannesburg. I think it was really wonderful for Monwabisi to give us insights on it. Otherwise, going to take a quick break. When we come back, News and Views continues.